This is the story of the Spanish flu in the territory of what is now the Qathet Regional District and the city of Powell River in British Columbia, Canada. In 1918, a devastating flu pandemic struck the world. This pandemic is known as the Spanish flu and was the most deadly pandemic in modern human history, reaching all corners of the globe, including Powell River. The pandemic lasted for 3 years, from January 1918 until December 1920, and is thought to have infected at least 1/3 of the world's population, resulting in the deaths of tens of millions of people worldwide. The first wave struck Canada during the spring of 1918 in the port cities of the Maritimes and Quebec. These ports were used by the soldiers returning from the First World War that was still raging in Europe. A more deadly second wave struck during the fall of that year. To respond to the outbreak, municipal and provincial governments across the country tried to slow the spread by prohibiting public gatherings and isolating the sick, but with limited effect. What is more, businesses faced a desperate shortage of healthy workers, creating an economic crisis in a country that was already reeling from the losses of the First World War. Probably the worst months in British Columbia were October and November 1918, when there was a surge in cases and deaths among young adults. In October of 1918, the virus arrived in the area of what is now Powell River. There were 200 cases of the virus reported at Squirrel Cove on Cortes Island, and the virus then spread as cannery workers who were canning salmon returned home at the end of the canning season. That month, it struck the Tla'amin Nation, who were living in temporary housing following the fire of March 1918 that destroyed the entire village at Tla'amin. The dreaded virus then made its way to the small mill town of Powell River, where Dr. Henderson, who's shown in the picture, with 2 nurses, including one his daughter, organized the response. There was a quarantine set up. The hospital was expanded. People started to wear masks and disinfect objects, and the sick were isolated. Volunteers made rounds home by home, checking to see who was well and who was not. Subsequent waves of the pandemic occurred in the spring of 1919 and then again in the spring of 1920. When it finally subsided, more than 55,000 Canadians and 4,000 British Columbians had lost their lives, with the highest mortality rate among those working in healthcare, including a pharmacist from Powell River. The death toll was high, considering that in 1920, British Columbia's population of 500,000 was about 1/10 of its current population. The town, with its very small population, saw 9 pandemic victims in the fall of 1918 alone. Years later, one of the most enduring memories of this pandemic was the lingering vision of coffins that had been needed. The quarantine eased up in 1919, though life did not get back to normal until the outbreaks finally stopped at the end of 1920. Many parallels exist between the Spanish flu pandemic and the current COVID-19 pandemic, though, as doctors would have said 100 years ago, every outbreak is different and people have to figure it out as they go along. This health guideline shown here was printed in October of 1918, and it gives advice that is familiar to those facing COVID-19. To prevent influenza, do not take any person's breath. Keep the mouth and teeth clean. Avoid those who cough and sneeze. Don't visit poorly ventilated places. Keep warm. Get fresh air and sunshine. Don't use common drinking cups and towels. Cover your mouth when you cough and sneeze. Avoid worry, fear, and fatigue. Stay home if you have a cold. Walk to work or the office. In sick rooms, wear gauze masks. Similarly to the present pandemic, churches, schools, movie theaters, and dance halls were shut down across the country, and hospitals were closed to visitors. One of the main differences in the Spanish flu was that most workplaces were not closed, in contrast to the shutdowns that are being experienced in this COVID-19 pandemic. Back in 1918, people forced themselves to go to work knowing the risk of influenza out of fear of losing their livelihoods. The pressure to keep workplaces open challenged strategies to stop the spread of the Spanish flu and explained the frighteningly high mortality rate. This picture, which is located in the Powell River Historical Museum and Archives, shows Dr. Andrew Henderson standing next to two nurses, including his daughter Marjorie. Dr. Andrew Henderson was born in Sorel, Quebec in 1853, and he graduated with a degree in medicine from McGill University in 1880. Dr. Henderson moved to Powell River in 1909 after being recruited by the Powell River Company to take charge of the medical services in the mill town. The first hospital in Powell River was a tent and bunkhouse before Dr. Henderson built St. Luke's Hospital in 1913. In order to finance the hospital, each mill employee had $1 of their salary withheld each month. In exchange, they received free medical care and medication without any further cost. Dr. Henderson served as a Powell River's physician until his retirement in 22, and he lived in Powell River until his death in 1935. Marjorie Henderson was born in St. Paul, Minnesota in 1888, and she joined her family in Powell River in 1910. As a young woman, she volunteered as a nurse at a temporary hospital that was located next to their family home. After World War I, she spent 2 years as a voluntary nurse in Shaughnessy Hospital in Vancouver. She spent most of her adult life with her family in Powell River and died in 1975 at the age of 87. If you would like to learn more about the history of quarantines or the Spanish flu pandemic in Powell River, there's an article coming out on this subject by local historian Karen Southern that will be printed in the next edition of the Townsite Digester, which is the publication of the Townsite Heritage Society.